Bismillah, alhamdulillah, wassalatu wassalam ala rasulillah. Today we are talking about topic known as croup. So we want to understand what croup is in fact. So croup is that when some virus at some time a bacteria attacks into the throat and then the infection spreads into the voice box or larynx and it goes a little further down into the trachea or the windpipe and cause swelling over there from both from two or four sides, and it narrows it down so that it's very hard for the child to breathe through it. So other name which is given to this disease is laryngotracheobronchitis. So it's a long name, but because it causes inflammation of all these areas. So most of time is very benign. There's no problem. Child may have some barking cough, and in a few days it goes away. But in certain cases, it can be very severe. So severe that if child is breathing, this breathing causes the noise in breathing. So what we call a stridor. It could be when he inspires in or whether he expires out. He has a sound known as stridor. At the same time, the baby, a child, is coughing, which is very fear creating, and we call it a C-line bark or barking cough. So next thing is what we want to try. What we are trying to find out that how and why it happens. So most of the time it is a virus which is causing all this inflammation and narrowing, and the most common cause for this narrowing is para-influenza virus. Although I heard about it very few times, but believe you me that in this disease the most common virus is parainfluenza virus. After that, there could be RSV, influenza, rhinovirus, ecovirus, and many like adenovirus and many other viruses. So, what are the sign symptoms? The sign symptom most common is the barking cough, or so it's like scary when you hear it. And on top of that, child can have like fatigue. Some they have little viral syndrome like fatigue and having fever, and other signs and symptoms of inflammation. So if we talk about diagnosis, the most common thing we find is typical cough, a barking cough, and stridor associated with. And the other way to find what is the problem is you do the X-ray of the chest, including the trachea and the larynx. So what we will see in that you will see that windpipe or trachea is narrowed due to inflammation under the larynx, so that whenever the air passes up and down, it causes a whistling sound or stridor, and the sign's name is steeple sign. So if you do X-ray, you see subglottic narrowing is known as steeple sign. So next question is that how we treat it. So like other very like many other diseases caused by virus are self-resolving. Like you have flu and other like uh, infection in your throat and other parts, it resolves itself. Most of the time, the same thing happens in the in croup, but sometimes it can get very worse, and the child may be it's difficult for him or her to breathe, and child looks toxic, and that's the time then we have to run to the emergency to find out if we can help the person. So doctor can identify easily and incidentally that the person has croup, or sometimes they go for x-ray and try to prove it through steeple sign, although in our country it's not a tradition. I've seen in United States they were trying to find the reason through the x-ray. So when we will do x-ray, there may be some air trapping, but it'll be normal, except that there is a subglottic narrowing. So how we can treat it? The number thing is that if the child has fever, we take care of that. We give proper hydration, and after that, if we see that this is like maybe a child is coughing too much and uncomfortable, we can start the child to have nebulization. So what we need to nebulize with is known as racemic epinephrine. So it's a form of epinephrine which helps to decrease this swelling under the larynx. But after that, we keep the child or baby in the hospital, in the emergency for a few hours. The reason is want to try it, we want to know whether it's stable or not. Because sometime after the effect of epinephrine gone, it may cause swelling again, and child may have other episode or problem. So keep few hours, and if the child bears it well, then they can send home. But if not, then we have to renebulize it. And another thing which we have to do is we have to give some steroids known as dexamethasone. One dose is considered enough, and so that the inflammation can go away with passage of time, and we don't need to give any antibiotics in this place. Last thing is that prevention. So we can prevent. It's not easy to prevent viruses for transmitting from one person to the other. The most important thing is hand hygiene. And every viral or any bacterial infection, we have to go to the hand hygiene, and our nutrition is good, should be good, and we should be well hydrated, and we should stay away from the person who has this problem. So hopefully you can get better. And if your babies, they are healthy enough and they have good nutrition, hopefully they can avoid from it, but it's never 100%. So hopefully it will give you some insight. Thank you.